what we want to do is cultivate a capacity for kindness. So, close your eyes. Take a few moments to breathe in and breathe out. So what we want to do is cultivate a capacity for kindness. So, close your eyes. Take a few moments to breathe in and breathe out.
Boredom's the perfect topic, huh? All right, chat.
Welcome to another Healthy Gamer GG stream. My name is Alok Kanoja. Just a reminder that although I'm a psychiatrist, nothing we discuss on stream today is intended to be taken as medical advice. Everything is for educational and entertainment purposes only. So if y'all have a concern or question, please go see a licensed professional. Yeah, so a couple of announcements. One is we've got about 1 week left for Right in the Feels. So for those of y'all that don't know, Right in the Feels is our community event. healthygamer.gg. Let's see if this works. Yep. So I'm going to just show y'all real quick. So we have a lot of people in our community who struggle to understand their emotions a little bit better. Their emotions hold them back. Sometimes they're not even aware that they have emotions. So we've talked about alexithymia, for example. So Right in the Feels is a event that is running right now. We're in the last week of it. We'll take a quick look here. So this is what Right in the Feels kind of looks like. And the goal here is to give y'all opportunities to learn a little bit about your emotions, track your emotions. What are you feeling right now? How strong is the emotion? Where is it? You can also like browse. So this is kind of cool. Like we'll ask you to write something about how you're feeling today. And then later, this is something we've gotten really positive feedback about. We'll ask you to reflect on it, right? And so you can kind of browse what you wrote earlier and start to like work on your emotions a little bit, start to become aware of them, things like that. There are also, this is kind of fun, but we can try to guess what people are feeling. So it's late at night and I thought I'd quickly do this before heading to bed. Woke up pretty late today and didn't do a whole ton, but enough to feel a little burnt out and a little stressed from some unpleasant interactions. Not very excited to be working tomorrow with an awful head cold and wearing a respirator, but whatever. Them's the breaks. So how do y'all imagine this person is feeling? Bad, stressed, out of control. Let's see. They were actually feeling sleepy. I'm sure they were feeling out of control too. So empathy labs ain't perfect, but it's a good opportunity to try to sort of imagine what other people could be feeling. We can also feel a little bit. We have a section on emotional regulation, and we also added like a DLC. So the event went so well, and we got tons of positive feedback. So comms check is an example of one of our DLC exercises where you kind of learn how to communicate your emotions better. And this is all kind of based on some interesting data we have that. One of the ways in which coaching helps people, we believe, is through bolstering EQ. So one of the interesting outcomes of coaching is that we believe, so we know that coaching has good outcomes. So people start to become more purposeful in life. They start to become more motivated. They start to accomplish more. Feelings of depression and anxiety and things like that start to reduce. So there's a sensation of motivation, control, purpose, direction. And so we were trying to figure out like how that works. And it's our belief that increased emotional awareness is a part of that. So this is an event that y'all can sign up for. It's completely free, by the way. Lasts for 1 more week and it'll sort of help you like over time build that EQ. Okay. Couple of other things. So at 2 p.m. today, we've got Ask a Coach on progress. So we'll have a good chance to kind of, for people in our community to talk to our coaches about progress, right? So what questions do you have about progress? This is to kind of highlight something that's kind of interesting. So if you really think about, the default training of a therapist, what are therapists trained to do? So therapists, generally speaking, practice clinically, right? That's why we have therapists. They diagnose things and they treat things. So if we're talking about diagnosis and treatment, what does that mean? That means that generally speaking, we're focused on pathology. So you don't go to a hospital to get into shape, right? You don't go into a hospital to put your life together. You go to a hospital if you've got problems, if something is broken. And that whole attitude has bled over into therapy. So I think even in the heyday of therapy, like if you go back 100 years, it was less so. But as our society has become more clinical and more outcomes oriented, right, with like this diagnosis and this diagnosis and this diagnosis, and there are certainly advantages to that. I'm not saying that that's necessarily a bad evolution. What we've sort of lost is like, how do we get from 0 to 100? And what therapy kind of focuses on is how do we get from -100 to 0? And that's kind of what I observed as, in my psychiatry training, is that I would have patients who would kind of come in and there was like something that was broken. So I had a patient, it was an eye-opening moment for me, where one of my patients came in for depression, and we worked on depression for about a year or so. And then they came in at about 10 or 11 months. And they said, I feel like the depression is coming back. And I said, what do you mean the depression is coming back? And I started asking them questions, right? So I started doing a clinical assessment for a depressive episode. So is this happening? How's your sleep? How's your appetite? Are you able to enjoy things that you normally enjoy? Any suicidal thoughts? Any changes to your psychomotor agitation or retardation? Anything like that? Like what's the, what are the symptoms you're experiencing? Any negative self-attitude? Any profound feelings of shame? Any of this kind of stuff? And they're like, no. Like, I'm able to work. I'm able to sleep. I enjoy the things that I do. I enjoy food. No changes to my weight or appetite. I just feel depressed. And then I talked to him for a while, and I was trying to figure out, oh my God, what's going on? I'm panicking here. This person is saying they're depressed, but there doesn't seem to be anything wrong with them. And then it hit me. I was like, you're not depressed. You're unhappy. And they were like, wait, what? And I was like, yeah, you're not depressed. You're unhappy. And he was like, well, what do I do about that? And I was like, I don't really know, but I think we can try to figure it out. And so what I really loved about working as a psychiatrist is that there were patients who we would sort of fix the pathology and then move on. We sort of move from negative 100 to 0 and then 0 to 100. And I was talking to the chief of psychiatry at the time at the hospital that I was working at. And I was talking to him about this kind of experience. We were just talking about, there was a super cool guy and was interested in, fostering my growth and all that good stuff. So I was talking to him about this, and I was like, this was really neat. And I really enjoy doing that kind of work. And he's like, oh, by the way, you should check out our coaching institute. And I was like, you're what? And he's like, yeah, we have a coaching institute. So there's a place called the Institute of Coaching, which is affiliated with McLean Hospital and Harvard Medical School. And I was like, what is this thing? And he's like, yeah, we're holding a conference in a couple months. You should definitely go. I was like, okay, cool. And so I went to the conference, and it blew my mind. Because what I saw is a group of people, and keep in mind, this is a coaching institute that's affiliated with a psychiatric hospital, was started by a psychiatric hospital. And then I started to wonder, wait, what are these people doing? And I realized there's a whole group of therapists out there who had sort of made the same discovery that I did, which is that the system of treatment that we have is not designed to help someone achieve happiness. It's designed to help someone with a clinical problem no longer be depressed. And those are two different things. There's a big difference between treating anxiety and being confident. There's a big difference between being depressed and being unhappy. And I think part of what's happened, and it's not that therapists can't help you with that stuff, but I think part of what's happened, and I think most therapists would agree with me, that our scope of practice and the pressures that we're under as therapists have actually been constrained. It's harder to do the work of a therapist now than it was 30 or 40 years ago. You could actually focus on helping people more easily as a therapist than you can today. And you may say, wait, what do you mean it's hard to focus on helping people? That's because as therapists, we have to check particular boxes. And every year that goes by, the boxes that we have to check increase and increase and increase and increase. We have all these certifications, we have letters after their name, we have all these protocols, and there's value to those things. I don't think that all of those things are bad by any means. There's a lot of value. There's immense value. And at the same time, what's being left behind is people who are looking for guidance, looking for expertise, looking for a process to help them figure out what they want to do with their lives. And that's part of the reason that we sort of went with the coaching stuff, right? And that's why we have a coaching program. And the program's effective. And it's so bizarre because people are and we'll sometimes get clients who will come in expecting a substitute for therapy. It's not a substitute for therapy. It's not designed to be a substitute for therapy. In fact, it's designed to be the exact opposite. Is all of the stuff that therapy is not. So if you're in the middle of a depressive episode, or you have an anxiety disorder, or you have PTSD, absolutely go see a therapist. But if you're interested in confidence, if you're interested in happiness, motivation, purpose, that's what we actually shoot for. Those are the outcomes that we measure. Because even if you look at, here's a simple example. If you look at therapy outcomes, studies on therapy, there may be some quality of life metrics, but the focus is on reductions in symptoms, right? It's like reductions in pathology. That's obviously that's what we study, right? Because that's what a treatment is for. And what we're discovering is that human beings especially nowadays, can benefit from some kind of formal guidance or process that helps you figure out what you want to do with your life, right? Why you're not motivated. And if those are the kinds of challenges that you have, struggling with loneliness, is this social anxiety disorder? Is it avoidant personality disorder? Or am I just lonely? Right? There's a huge difference between those two things. And I think what we're seeing is that a huge part of society identifies with being loneliness. But if you look at the rates of diagnosis of avoidant personality disorder, it's less than 1%. I think, pretty sure. And so I don't think suddenly the rate of avoidant personality disorder has skyrocketed over the last 20 years. I don't think that all these personality structures are changing. I think that we've forgotten how to connect with other human beings. Our society doesn't support that. Anyway, so if y'all are interested in that kind of stuff, you should definitely check out our coaching program. Our outcomes are quite good. So we tend to see something like a 58% increase in a sense of life purpose at the 12-week mark. And part of the reason this is kind of top of mind for me is because we're actually going to be talking a little bit about therapy today, and sort of some of the things that people don't know about therapy. So let's actually, and if you guys are curious about, okay, what does that mean? What does coaching do? So definitely hop in to Ask a Coach at 2 p.m. today, and y'all can ask your questions about progress. And coaches will be there sharing their experiences or thoughts about what progress looks like, how to make progress. Okay? Yeah, so Axel Hose is saying therapy hasn't worked much for me. It's just the therapist telling me things like a lecture. Yeah, so I mean, that's where I'd say maybe consider getting a different therapist, but we will talk a little bit about that. So today we're going to cover a couple of different things. Okay? We're going to talk about... Does anyone feel envious when you see how much you're struggling, stuck, or barely progressing? Meanwhile, others are able to make a ton of progress super fast and easily or without even giving a F. That's one thing we're going to talk about. I think something should be done about bad therapists. I had a lot of bad therapists in my life, and I think this is what needs to happen. So I don't know if this was a post made by Axel Hose. We'll see. And how do we explain a desire for stimulation? So this is a cool topic. These are all great topics. So I'm going to talk to y'all for a second about these. So why did we pick these three? So I think there are some things that we got to just explain about all three of these topics. And I love all three of them because they're quite different. Right? So one is about change in making progress. One is about understanding a couple things from therapy. And the third is about some one of these core things to understand about how your mind works. Okay. So there's kind of a very practical thing around therapy. There's a more deeper understanding thing around change. And then there's hey, let's understand the mind 101, neuropsychology 101. Okay. So it seems like people are talking about therapy. So let's talk about that. All right. Okay. So let's take a quick look at this. I think something should be done about bad therapists. I had a lot of bad therapists in my life, and this is what I think needs to happen. So we're going to go through these one at a time. But I want to talk to you all a little bit today about bad therapists, or more importantly, why therapists do certain things that seem really, really confusing to patients. So when patients go to see a therapist, there are all kinds of problems that we tend to see with a therapist or therapy. So we'll see a particular problem and we'll have a complaint, right? And so as we'll kind of go through these complaints, I'd like to share a little bit about why therapists do things in a very strange way. And I think this is really important because it's kind of weird, but everyone sort of says, go to therapy, right? If you've got suicidal ideation, go to therapy, which is absolutely what you should do. The downside is that we don't really explain to people why therapy works, why it's so weird. And if people don't really know what they're going for or don't really know how it works, what we tend to see is people tend to have very bad outcomes in therapy because you're really confused about what you're doing there or why they're doing things in a particular way. So I think there are some fundamental things that we need to understand about how therapy works so that we can better utilize this tool. Okay, because there's a lot of stuff about therapy that's like really weird, right? So let's kind of dive in. So the first is, in the first session, a client should be able to ask as many questions about their therapist as they like. This builds trust. So the first thing that we're going to talk about is self-disclosure in therapy. So in general, what we're trained as therapists is to not give any information about yourself. And some of the more kind of old school therapists will really give like no information whatsoever. So if you even go back to people like Sigmund Freud would sit behind his patients while they laid down, and they wouldn't even be able to see him. He certainly wouldn't answer any questions about this himself. The dude would barely talk. Like, he would say almost nothing. And there's a dude laying down, a man or a woman laying down in a bed or on a sofa. And there's a dude behind you who's just sitting there silent for like an hour. And this is the most classic form of psychotherapy, right? And so like, this is kind of weird. And when you go to train to become a therapist, they're like, don't tell the patients anything about yourself, right? They won't say it precisely that way. I think we've learned a little bit, especially in the age of social media and like therapists having websites and things like that. But generally speaking, we're taught to not share details about ourselves. And that can be really weird for patients, okay? So like, I'll give you all an example. So, you meet someone for the first time. Hi, my name is so-and-so. And you're talking to your therapist and you're like, oh yeah, so are you married? Like, you're just meeting someone for the first time. Oh, what do you do for a living? Well, I know what you do for a living. You're a therapist. Oh, tell me a little bit about why you decided to become a therapist. Oh yeah, okay. And by the way, are you married? Do you have kids? Like, we're making small talk, right? Because that's what we do at the beginning. And then the therapist is like sitting there, right? And the therapist is like, You ask them, hey, so are you married? Do you think I'm married? What do you think? What would it mean to you if I'm married? Right? And they never answer any questions. They just like answer questions with questions. And like, why the hell do they do that? And that makes things feel really awkward because you're there and you're not really sure what this person is doing. But there's kind of like, you can feel this barrier, right, between you and them. And then how are you supposed to like connect with this person if that like barrier is there? And they're like, oh, like, why are you asking about whether I'm married or not? And they kind of like always turn things back on you. And so this sort of makes sense, right? Because after all, you're not in therapy for them, you're in therapy for you. And sometimes you can get something of a narcissistic or oblivious therapist who talks about themselves the whole time in therapy because I think it's going to help you, right? So that's kind of a mistake. So like, what's going on here? So it turns out that the main reason, and this is a good reason, I think, that therapists are encouraged to not self-disclose is because the more information you disclose about yourself, the more the patient will start to judge, bucket, and assume that you understand or don't understand something. So if I tell someone, yeah, I'm a parent, they're going to be like, oh, okay, now this person can understand me because they're a parent and I'm a parent. And so the more that you disclose about yourself, like let's say I'm heterosexual or homosexual, I'm an atheist, or I have particular political beliefs, I love this kind of anime, but is it a little bit too like anime schoolgirl, like the more that you disclose about yourself as a therapist, the more it gives patients opportunities to judge you. So paradoxically, what we tend to find is that if you talk a lot about what you're interested in or things like that, what it actually tends to do is turns this therapy relationship into a more normal relationship. And so I'll give you all kind of a simple example of this. When you meet someone at a party and they ask you, what do you do? Why do they ask you a question about your profession? What's the goal of that question? It's to stratify you socially, right? It's a question that basically is like, how much am I supposed to respect you? Are you like a very respectable person who makes a lot of money? Or am I better than you because you're at the bottom of the totem pole and you're like, you're not really doing anything with your life? So if we think about even answering a simple question like, what do you do, encourages people to judge and stratify you. So one of the key reasons that we actually try not to answer questions about ourselves is not because it's not because we're like super tight-lipped and don't want to share anything. It's because we've actually learned in the field of therapy that answering questions about yourself can sometimes give people the wrong impressions. The other thing, and there's a lot of other stuff too, but I think that's one really important thing to consider, is that the more that we answer about ourselves, the more assumptions the patient is likely to make about ourselves, our views, etc. Okay? Second thing. Throughout each session, a client must ensure that a therapist has his or her client best interests at heart. I would argue that a therapist should not be doing this for money, but rather because a therapist truly wants to help this individual to get better again. What a great idea, right? Because here's the thing. A lot of people are concerned, and I myself have struggled with this, about charging for therapy services, right? Because like, how do you know if this person charges for therapy services? How do you know? Are they just doing it for the money, right? And in the most insidious cases, is this person actually incentivized to help me? Because if they get paid per appointment, the longer I don't get better, the longer I stay sick, the more money the therapist makes. So if we really kind of think about it, is it even possible that a therapist being paid for what they do actually runs contrary to the interests of the actual patient, right? Because it kind of makes sense. It's kind of scary. So should therapists be paid at all? Well, let's kind of think about this a little bit. So what happens to professions where people don't get paid? What ends up happening, right? So let's assume for a moment that no one got paid to do therapy. What kind of therapists would we end up with? And we say, oh, okay, these are people who are doing it for the good of it. Okay, so then like, how is that person gonna make their ends meet? How's that person gonna get paid? If therapists aren't gonna get paid, then who's paying them? Or are they not gonna get paid at all? Is the government paying them? Like, where is the money coming from? How are we compensating them? And furthermore, depending on how well we compensate them or how poorly we compensate them, what does that do to the quality of the therapist? And so I'll share with y'all a couple of like really simple, interesting observations that I made. So at one point in my private practice, I had about 30, this is the height of the imbalance, but 30% of my clients were free. 30% of my clients were paid. 70% of my patients were actually free. I was providing free care for them. And so one of the things that I observed was actually like that the patients who I was seeing for free had about a 20 to 25% no-show rate, which means they skipped 1 out of 4 appointments or 5 appointments. Whereas the patients who were paying skipped about 5% of appointments or even less. And even if they did skip, then they wouldn't never not show up. They'd like email me or something. Sometimes it would be an emergency and things like that. But like their engagement was way higher. And so one of the things that's kind of interesting is when you stop paying people for things or you start to offer things for free, what we tend to see is kind of a decline in stuff. And we saw this actually in coaching too. So when we said, hey, we're going to start a coaching program, we got like 1,000 people. And that's not even an exaggeration. We got 1,000 people who are like, we want to volunteer. I want to make the world a better place. And we're willing to volunteer. So we had this pool of free labor. And we actually chose not to make it a voluntary service. Why not? Because think about it. So if someone's volunteering their time and you're the client, how reliable is that person going to be? Because this is what we found is that when people volunteer, right, like, unless I'm getting something out of it, like, I can cancel, like, I'm not going to show up. And so I'm with this person that, okay, like, so maybe a therapist should have their client's best interests at heart. I completely agree. There are ethical standards around that. And we all take, oaths and things like that. So as a medical doctor, you take the Hippocratic Oath and you sort of like, agree to particular ethical standards. And at the same time, I think that you've really got to think a little bit about, does my therapist, is it okay for them to get paid? I personally think that therapists should get paid. I think therapists should get paid a lot. I think teachers should get paid a lot more than what we pay them. I think the people who deliver value to us should be compensated well. And the more value you deliver, I think it'd be great if you were compensated really well. Now, just to dispel one kind of simple thing is, for people who are concerned that, oh my God, this person is my therapist and they're going to keep me sick so they can keep making money off of me. If you're a therapist, in a sense, how ridiculous this idea is because there's no shortage of patients, right? Everyone has waiting lists. And if you just think about it, what is the wait time to see a therapist? How long do you have to wait to see a psychiatrist? It's usually 2 months, 3 months, sometimes even 6 months. And why is that? It's because there's no shortage of patients. And what we're actually finding is that now, maybe this will change one day, but for now, at least, there's like, the therapist doesn't need your money. There's a line of people out the door who are looking for help and have money too. So I really understand why people would be concerned, right? Because there are certainly scenarios at which therapists' interests and compensation run contrary to the patient's best interests. But honestly, in my experience, it's not really the case. And that generally speaking, we want to compensate people for stuff because if we stop compensating them, then the quality of service that we're going to receive goes way down. Just my perspective. Okay. Third thing, a therapist must focus on the traumas within their client. Whether it is childhood, teenage, adult trauma, this should be discussed. Okay. So this I have sort of mixed feelings about. So the first is that when I hear these absolute statements from patients, a therapist must focus on traumas. Well, like my first question is, well, what if they don't have trauma? What if trauma is not their problem? Now you can come back with that and say, but all problems originate in trauma. You can absolutely make that argument. And there are therapists who will support that. I happen to be one of those therapists that believes that trauma has way more to do with mental health or mental illness than we really give it credit for. I think that a lot of these things, so even if you look at, for example, some of these modern theories or new research on major depressive disorder and mood disorder, that they may be more trauma related than we originally thought. So there's a lot of evidence that shows that trauma is a really big piece of it. But like, what if people don't want to focus on their traumas? Because I've certainly had that before, where I've had patients come into my office who have had, let's say, sexual trauma in the past. And when we talk to them a little bit, they'll come in and they'll say, well, I'm having trouble being intimate with my partner. And I'll say, okay, so like, let's understand a little bit what's going on in your life. And they'll say, yeah, I was sexually abused. And it's like, oh, well, maybe those two are related. And they're like, yeah, I absolutely think it's related. But I don't want to focus on that. I want to focus on the here and now in the future. I want to focus on building intimacy. I don't want to talk about my past. I actually don't want to mess with my trauma. And oddly enough, the two are not necessarily related, right? Sometimes we can actually focus on a problem in the present without actually digging into the past. And in fact, sometimes the reason, I know it sounds kind of weird, but the reason that we suppress trauma is because it's adaptive up to a point. It can quickly become maladaptive if we over-suppress. We're not saying that trauma-oriented work isn't important. But I think that we should just be a little bit careful about, always focusing on a particular thing, because I really don't think psychotherapy is a one-size-fits-all kind of situation. Now, why do I hear patients make statements like this? This is a really good point. And usually a statement like this comes out of a couple of things. The first is bad experiences with therapists. So if you go to a therapist for like a year or 2 years or 3 years, or you try 3 therapists and you're not getting better, you can walk away from that kind of thinking, okay, well, I would have gotten better if they had focused on trauma more, if they had focused on trauma more, if they had focused on trauma more. And then you take your experience and you generalize it to everyone else. And especially if you've had experience with 10 therapists, then it's like a more general statement, right? Because now it's not just that therapists shouldn't, I don't know if that kind of makes sense, but if you've gone through 10 therapists instead of 1, you can say this is a problem with the profession. It's not a problem with me. So here's how I'd kind of respond to that. The first is that it's a fair assumption. The first thing I'd say is that if you want to focus on something in therapy, you should tell your therapist. That's like really, really important. I don't think that the entire profession needs to focus on it just because you think it's important. I think the real thing that you should focus on it in your therapy. Absolutely. Every therapist you work with should focus on trauma. That's the first point. Here's the second tricky point that we want to avoid from time to time, is that sometimes patients don't know what they need. And sometimes patients have in clinical opinions, like an incorrect perspective on what's going on. Now, this is where there's a whole other can of worms about, okay, like paternalism in medicine and like condescending and patient autonomy and stuff like that, right? You're coming to a doctor and they're an expert of sorts, but you're the patient. So you should have a lot of power and you should be able to a certain degree dictate your treatment. But there are like some examples of that really not being the case, right? So I'll just give you all a couple of examples. So, let's say you have a patient who comes in who has a substance use disorder and they think they have ADHD and they say, well, like I need a stimulant medication. I need methylphenidate. I need Adderall. I need these medications. This is what I need. This is what I need. This is what I need. And your clinical assessment of this person may be different from what they think they need. And so what do you do in that situation, right? How much do you let a patient dictate treatment? There are other examples of this as well, which is like if you look at someone who's got, let's say, narcissistic personality disorder or borderline personality disorder, or someone who's got like factitious disorder or Munchausen's, or even something like body dysmorphia. And so sometimes patients will come in, or someone who's got a delusional disorder. A patient will come in and will want particular things, right? So in the case of delusional disorder, yeah, I need you to write me a note for work because the FBI has been following me and I need 1 month off of work so that I can, clean my tracks and like scrub my life because the FBI is following me. This is what I need from you. Sometimes you have the case of someone who's like got narcissistic personality disorder. This person is a narcissist. I'm here because everyone keeps abandoning me. The whole world is the problem. There's nothing I'm doing. Like, I'm a victim. I'm here for, and I've seen this so many times, where a narcissist comes into my office and complains about PTSD. And I'll be like, what's the problem? They're like, I've been traumatized. Why have you been traumatized? Everyone traumatizes me all the time. They treat me like crap. They've abandoned me. I didn't get invited to Christmas this year. I'm on probation at work. I'm a victim. I've been traumatized. I've been traumatized. And then you kind of like stop for a second. You kind of start to do a clinical assessment. You're like, wait a minute, maybe this person's narcissistic, right? So there are a lot of cases where this is what's kind of tricky. What you think is a patient may be the problem, may not be the problem. Now, it's really important to offer a caveat here because the exact opposite is true. I've also seen tons of cases where a good example of this is like, patient comes in, is worried, I've got cancer. People do some kind of workup. You don't have cancer. It's all in your head. I'm really worried. Something's wrong with me. Something's wrong. Nothing's wrong with you. We're going to send you to a psychiatrist. Sometimes they get sent to me. They're like, yeah, I got sent here because I'm a hypochondriac, or my doctors think I'm a hypochondriac. And I'm like, okay, what's your problem? And they're like, I'm afraid that I've got cancer. Right? And doctors haven't listened to this person. And sometimes, I know it sounds wild, sometimes they're not a hypochondriac. Sometimes they've actually got cancer. Sometimes the physicians aren't taking them seriously. So we're not saying it's either or. Sometimes, doctors can make all kinds of mistakes about what they think is wrong with their patient. When a patient asks for something, maybe you should strongly consider giving it if you're a therapist. But from a patient's perspective, you've got to understand that, like, in any individual case, we don't really know which one it is. And in my experience as a therapist, it's like somewhere in the middle, which is that you think you need this, I think you need this. Chances are it's like a little bit of both. That's why ideally what you should do is tell your therapist what you think you need to work on, advocate for what you think the problem is. And also, like, I think the most important thing is that you should keep an open mind about what they say, and they should keep an open mind about what you say. A good therapeutic relationship is not about who's got the right answer. It's about both parties keeping an open mind and really listening to the other person. And when I've seen therapeutic relationships where both parties have open minds, that's when I've seen the best outcomes. So this is a simple example. I was working in the emergency room one day, and I had a patient come in. And they said, yeah, I was being evaluated for psychosis. And they said, yeah, I'm here. I don't think I need to be in a mental hospital. I said, why not? And they said, well, my chakras are out of balance. And I said, what do you mean by that? And they said, like, oh, yeah, all my energies are out of balance. And it was very psychotic. And so I was like, hey, let me ask you a question. So I've actually trained in some amount of Kundalini yoga. Would you like me to assess your chakras? And they're like, did a double take. And they were like, okay. And so I did an energetic chakra assessment. And I came back to them and said, so I do see that your chakras are a little bit out of whack, but I don't think that they're so out of whack that they can explain what's been going on with you. I think you're actually going through an episode of psychosis, which I know sounds really bizarre. And they're like, oh, that's really interesting. And I was like, I think you should stay in the hospital. And they're like, okay, I'll give it a shot. And it was like bizarre. First and last time in my life that I did chakra assessment in the ED. And I told this person, I was like, hey, like, let me check out your chakras. And they're like, okay. And it worked out great. So keep an open mind. They ended up getting into treatment, right? So we want to use evidence-based treatment. We talked to them a little bit about that. There's all kinds of different stuff about complementary alternative medicine that is a conversation for another day. And it wasn't like I was lying to them. I was like, hey, I've learned this thing in India. Would you like me to do it? I don't think it's going to hurt anyone. I also talked to my supervisors about it because I was a resident at the time. They thought, I was like, wait, that's totally fine. Did you hurt them in any way? Did you draw any blood? Were you And then I was like, no. And they're like, okay, great. So you explained what the standard of care is for medicine. You explained what your diagnostic process is. And they're like, yeah, absolutely. They're like, fantastic. Patient ended up doing great. We ended up doing some more like yoga and stuff as well after they were hospitalized and started on antipsychotics. So it was a great outcome. I think the key point is like keep an open mind. Okay. Next thing. So speaking of hospitalization, while medication in mental hospitals may be a perfect solution for the client's needs, it should not be the first. This should not be requested by the therapist at all, in my view, and it should only occur if the patient requests a mental facility or medication. This prevents authority over the client. Often medication or mental hospital isn't a good option when a client may just struggle with traumas. So this too, I think, is a really, in a lot of ways, a good perspective. But I think we've got to talk a little bit about why do we lean on medications in hospitals so much, okay? So why do we lean on medications? So if I were to ask y'all a question, why do you go to therapy? What can you expect from therapy? And because a lot of people, what the question that they have is, what should I expect from therapy? Why is there so much hesitation to go to therapy? Because you don't know what you're going to get. If I go to therapy for 8 weeks, will I be fixed? Will I be in a romantic relationship at the end of 12 weeks? Like, what can I expect from psychotherapy? Because that's what we want, right? When you order a product on Amazon, brought to you by Twitch TM, you have an expectation. You want to know what you're buying, right? You're going to look at video game reviews online. You're going to look at Steam reviews. You're going to look at Amazon reviews. You're going to ask people. Everyone wants to know what they're getting. Before you go eat at a restaurant, you're checking for a Yelp review, right? So we all have expectations. I don't want to go to therapy for 12 weeks unless you can guarantee me that I'm going to get better, right? Makes sense. Even today, we have great outcomes in coaching, but what's the primary hesitation that most clients have about coaching? Will it work for me? And that's where we can say, this is what it does for the average person. We're not sure if it can work for you. We can't predict the future. And everyone's looking for a guarantee. And so you know what that biases us towards? When you have a ton of patients who are looking for guarantees and expected outcomes, that's why we have medication. That's why medication has grown so much, because medication is standardized. We've done clinical trials on thousands and thousands and thousands of people, millions of people. And we know what to expect from medication because it's a physical substance. So if you go to psychotherapy, what if you focus on traumas? What if you don't focus on traumas? Like, what's going to happen? By the way, the reason we continue to do psychotherapy is because there's very strong evidence-based outcomes that it is effective as well. This is also why we're seeing more protocolized therapies more recently. So there's an emphasis on cognitive behavioral therapy, dialectical behavioral therapy, things like that, right? So it's not that there isn't evidence to support psychotherapy. It's just what you can expect is way clearer with a medication. The other reason that people will jump to medication so quickly is because psychotherapy takes time and energy and money. And medications, generally speaking, may take money, but they don't take time and energy. And we're a society increasingly as patients, and if you're in the medical profession, you'll sort of see this, where people don't want to piss around, right? People don't want to spend time. They don't want to spend energy. I want instant gratification, right? Like I want something that'll make my problems go away. And this generation, especially, we're getting closer and closer to this, where like we want instant gratification. We want things to be fixed now. I don't want to wait 8 weeks for a clinical improvement. I want a medication today because I want to get better today. I don't have time to do psychotherapy and cognitive behavioral therapy for ADHD and learn organization and prioritization skills because I have a final in 3 days and I need me some fucking Adderall. Where's the script? I don't have time to learn how to organize my life. I got games to play. I got parties to go to. I got tests to study for. This is what's happened. So why is our society so medication-based? You can sort of blame drug companies and stuff like that. By all means, like you can do that. And there's some truth to that. I'm not saying there isn't. But the real reason that everyone wants to give medications is because lots of patients are happy with them. And you may say, but wait a second, I'm not happy with it. And this is where you guys have ever been sick with a cold and you go to your doctor and you ask for antibiotics. Your doctor is like, it's probably viral. You probably don't need antibiotics. But you want antibiotics. You want this shit to go away. You don't want to wait. So interestingly enough, I think the reason that we've moved more towards medication is because we sort of do know that we're more confident that you can get something out of it, right? Whereas psychotherapy is like a little bit of a question mark. Sometimes it takes a year to have a breakthrough in therapy. Sometimes it takes 3 years to have a breakthrough in therapy. Sometimes it takes 2 weeks to have a breakthrough in therapy. Like, who the hell knows how to have a breakthrough in therapy? So when it comes to some of these systems, I'm all for minimizing medication use as a psychiatrist. I know that sounds weird. So I'd say that about 30% of my patients are on a medication when I was doing full-time practice in my private practice, right? So I did a lot of psychotherapy medication when needed, and then you pull it off kind of when able. Same time, I think it's great. But what I really found is that medication is not, I mean, you can blame pharma companies and you can blame people for jumping to meds and things like that. The reason that we do it is because it's easy and it tends to work pretty well, whereas psychotherapy is like more of a question mark. I personally think it's way less of a question mark than a lot of other people do. I think it's a fantastic intervention. I think therapists do a wonderful job. But I think that this is kind of a situation where it's like, you know, the system was not just designed by pharma or doctors, right? It was heavily designed by patients too, influenced by patients in a lot of ways. I'm not saying that they're the only ones responsible, but, you know, sometimes people just want a pill to fix their problems. Okay, last thing. Our system needs to be less screwed up. I blame our social hierarchy on a lot of our problems within the mental health field. All right, so that's a fair sentiment too. So let's think about this. Why is the system of mental health treatment so messed up? So I think there are a couple of things that have been happening. So as we move towards evidence-based medicine and as we have trials, right, that tell us on average, this is what we should be doing. So the more evidence we collect, and remember that evidence-based medicine is about populations. So what we do is we look at 1,000 people and we say, okay, medication helps on average by 30%. But if you really tunnel down into the studies, what you tend to see, or not, I don't know if it's fair to say tunnel down into the studies. What I'd say from my clinical experience is that if medication has a 30% improvement, I don't actually expect a 30% improvement for one person. If you give the medication to 10,000 people, on average, you will see a 30% improvement. Realistically, what you tend to see is about a third of people get way better. The medication is miraculous. A third of people get somewhat better, seems to help. And a third of people really don't benefit from the medication at all. So what we're really seeing is that there are subgroups here where the actual variability in treatment outcomes is way higher. So now what's kind of happening is as we get these population-based things, we start to develop protocols. And the more population-based protocols we have, the less that will translate to an individual person. So I think a huge problem, I know it sounds kind of weird in modern medicine, is that we are sort of like building treatment protocols based on the average person. And no person is average. In fact, this is what I think is fun about being a doctor, is that at the end of the day, you can have all of the protocols, but the most effective doctor in the practice of medicine is ultimately individual. It's based on a particular patient. How do I need to modify the protocol? How do I need to adjust the protocol? What applies for this person? What doesn't apply for this person? Does this person need psychoanalysis? Do they need to lay down on a couch and have someone like listening to them talk for an hour? Or do they need cognitive behavioral therapy? Do they need mindfulness? Do they need medication? Do they need hospitalization? There are all of these different options. And the fun part for me is trying to figure out, okay, what's a personalized, tailored approach for what works with this person? The downside is that what we've discovered is that when you have 1,000 clinicians who are all doing what they think is best, those 1,000 clinicians get outperformed by people who follow protocols. That's really tricky. So if I take 1,000 people and I say, you be an individual, you be a personalized chef, you make a perfect dish for this person based on what you think. And then I take 1,000 other clinicians over there and I say, you guys follow the rules. If an SSRI doesn't work in 8 weeks, you guys switch it to this. You switch it again. If 3 SSRIs haven't worked, you stop giving him an SSRI. You do this. What we tend to see is that clinicians who follow protocols, on average, across a population, will outperform the ones that are highly individual. And so what we tend to see is a system that's like really tricky. And then we get into insurance, and then we get into billing and diagnosis and medical legal crap. So you're assessing people for suicidality on every single visit. You're asking people if they have stomach pain or rashes on every single visit, even though they've never had stomach pain or rashes in their life because you get compensated a little bit more. Or you're in a socialized medicine country that mandates that you have to do particular things to assure quality standards. And so in order to in order to avoid missing someone's suicidality over here, we've got to get 99 people to ask for it when we don't need to. And so this is the tension in our system. This is what's going on. Social hierarchy may have something to do with it. I don't really know. But I think that part of what's happening is medicine is becoming standardized. Therapy is becoming standardized and protocolized. And that helps in a lot of ways, because what we're doing is raising the floor on a lot of bad therapists. The problem with that is that we're also, in my opinion, lowering the ceiling for the good therapists. Because now I have to spend a particular amount of time asking a bunch of questions that I don't really need to ask because someone has mandated it. And on the flip side, this is what's really interesting, is no one thinks they need to ask their questions, but what we know is that there are a lot of people who don't think they need to ask those questions. And when we force them to ask the questions, it turns out that actually helps the patient. Oh, I don't need to assess my patient's suicidality. The best example of this is substance use. You would be amazed at how many therapists do not assess for substance use. And they probably all should be, right? That's like a really good example of something that you miss the whole time. Because you can talk about your traumas, and you can talk about this, and you can talk about that. And they have this narcissistic personality structure, and you get enamored, and they're secretly homosexual, and they've been struggling with that their entire life. And oh my God, that gets therapists so excited. And instead, like, their depression has nothing to do with their closeted sexual identity. It has everything to do with the fact that they're drinking 24 drinks a week. That's why they're depressed. And so it's really easy to miss stuff. So why is mental health so screwed up? At the end of the day, I think it's multifactorial. Why are we talking about this in the first place? Why is Dr. K ranting about this crap? It's because if you are a patient, you should understand why therapists do things the way they do them, so that you're not bewildered, because it's friggin' weird, right? Therapists do some weird crap. It's like you ask them a question. What's your favorite movie? What's your favorite movie? You ask them a question. Do you like dogs? What would it mean to you if I liked dogs? What would it mean to you if I didn't like dogs? And it's freaking weird. And you're wondering, why do therapists give me medication? Why do they not give me medication? What's the deal with hospitalization? Is this person just, am I basically like a money tap for them, where like the longer I keep coming, they keep kind of milking me? Or do they actually want to help me? Well, how does the financial conflict weigh against their actual desire to help me? Are they trying to keep me hooked on therapy? There are all these valid questions which y'all have, and here's the problem, is we can't even explain that stuff in therapy. Because the first time you come in as a patient, what are we going to do? You're coming in for a reason. We got to talk about that, right? I can't sit down to you and say, hey, by the way, welcome to therapy. For the first hour or first 2 hours, this week and next week, I'm going to explain to you the rules of therapy. I'm going to tell you why I don't answer questions about myself, why I charge you money, why I don't charge you money, why I recommend medication, why I do this, why I do this, why I do this, why I do this. And now 14 days have gone by. They bill you for 2 appointments and you haven't even gotten to open your mouth. So I don't even blame therapists for not being able to explain this crap, because when you come in, you want to talk about you. They want to talk about you. So when do you learn these things? I guess here, now, in this lecture. So if you're curious about why therapists do the things that they do, if you're curious about why therapy is so weird, or you're thinking that therapy doesn't work for you for reasons A, B, and C, hopefully this has been helpful. Questions? Y'all get me? Like, it's tricky. It's really confusing. It's like, here's the problem. Here's the problem with therapy, is it's not like any other interactions. It's like weird stuff, man. It's really weird. You go, like, in most places, if I start crying about how I've been abused, people will, like, hug me and tell me it's going to be okay. Whereas, like, what does a therapist do? That must be hard for you. And it's like, what the fuck, man? Are you soulless? Right? And this is something, if you guys caught our group stream yesterday, you may be like, my God, my therapist is a complete asshole. But here's what's going on in our mind. Okay, so this person is displaying a lot of emotion. And what they need to learn how to do is to tolerate that emotion. And if I get up and I hug them and I pat them on the back, and I suppress the emotion, if I take the emotion away from them and I make them feel better, they're actually not learning the skill that they need, which is to be independent. If the therapist stands up at that point and hugs you, it could be encouraging your dependence. There's a bunch of crap. The reason that we're quiet is not because we're not paying attention. It's because we're weighing like 1,000 things in our head while we're listening to you. Do I hug or do I not hug? Can this person handle it? Can I put themselves together, or do they need me to step in? How do I gauge those odds? How long am I going to sit here and wait? Do I say something? Do I get up? Do I hug them? Would they feel weird if they're hugged? You know, for all y'all that are socially anxious and are thinking 1,000 thoughts, like anytime you're interacting with another person, that's what we're doing. That's why we're silent as therapists, because we're thinking 1,000 thoughts. What's the right move here? What's going to help this person the most? Because there's all kinds of stuff that you could do, and each one of them is going to be different. Do you offer them a box of tissues? Does offering them a box of tissues make you heartless or make you compassionate? How is this person, based on how they've lived their life, going to see a particular simple gesture as like giving them a tissue? How do you demonstrate compassion? Do you hug? Do you not hug? Right? That's what we're doing. And there's like a whole system in the back. Okay, does this person need to do it on their own? Or do they need my help? Or do they need, just a simple other example is like, instead of independence, maybe what this person needs to learn is positive self-talk, because the reason they're crying is they're beating themselves up from negative self-talk. So then the question is, okay, so if this person is crying now, like what I'm going to do is I'm going to like talk to them, right? I'm going to model self-talk, right? And I can say like, oh, like it's, you know, it's not, it must be hard for you. It's like, wow, you've really been through a lot and you don't deserve the pain that you're going through. You didn't do anything to deserve this. Right? And that's like you modeling self-talk. And if you say that enough times, they may argue with you the first couple of times. And then they'll start saying it themselves. So it's really to help someone stand up on their own 2 feet. That's my philosophy as a therapist. And I think that, like, you know, that's our approach. And interestingly enough, we kind of carried that over into coaching. And what I loved about coaching is really about fostering independence. Therapy can be too. Like, I'd say most therapists would agree with that. But I think in practice, that's not what our protocols are. Right? If you look at like a workbook, like a CBT workbook, actually, maybe CBT workbooks are good examples of fostering independence. If you look at a text on psychoanalysis, I don't know that their goal is fostering independence. But once again, that could depend on which text you're reading about psychoanalysis. So you're looking at like Erik Erikson, it's all about fostering independence. So anyway. Yeah, so I'll give you all interesting tidbit. So if you're a patient with ADHD, I'll give you all a tip. If it's hard for you to be in therapy, take some knitting or sewing with you. So there's evidence that shows that if people with ADHD are doing something with their hands, it actually helps them concentrate better. So one of the saddest things that I tend to see is that a lot of students with ADHD will get punished for doing something else during class. And the big irony here is that doing something else during class helps you concentrate. It's really bizarre. But like some of the most, I worked on an inpatient unit once, and like everyone was knitting. And I walked into the room for group therapy and everyone like pulled out their knitting. And I was like, what the hell is happening here? And it turns out that like they learned that, oh, like knitting actually helps me like stay engaged, helps me like modulate my emotions so that they don't overwhelm me and I can participate in therapy in a productive way. And so it was like knitting club. And it's just something they did on the unit. It was great. Is that better for ADD too? Probably. More for H than straight D, but probably. Great question. Okay. What to do when you feel like the therapist is judging you? Tell the therapist, I feel like you're judging me right now. And then you get stuck in the trap, the loop of therapy, which is now they're judging me for telling me that I feel judged. Now they're judging me for feeling judged. Right? Talk to your therapist about it. And now this is where it's got to be kind of tricky. So there's like, let's see how good of a therapist you are one-on-one. So if a patient says, I feel like you're judging me, what's the right thing to say as a therapist? Number one, reassure them. No, I'm not judging you. Number two, what makes you feel that way? Number three, what is the judgment you think I'm making about you? Number four, hell yeah, I'm judging you. Is that a problem? What do you think is the right thing to say? So this is my point, right? Which is sometimes it's number four. So like sometimes I'll say number four. I'll be like, yeah, I'm judging you. Who the fuck cares? Right? Are you living your life for the sake of my judgment? Are you trying to make me judge you in a particular way? Like, who the hell cares? Like, why do you care what I think, man? What do you want? People are going to judge you all the time, bro. Does it bother you? Like, you know. And I'm not, and this is what's tricky, is none of them are right or wrong. It's about where the patient is. Is it okay for me to judge you? What's so, like, I'm just another person, right? So it's like, yeah, it's based. But it's not, the real answer, there's not a real answer. That's the whole point, right? Is like, each of those is right in a particular way. And some of them will make therapists cringe. They're like, oh my God, how could you say that? But I think really like one of the best things you can help people do is recognize that people are judging you and what's wrong with that, right? Like, so what? Well, then people won't like me. Okay, so let's dig into that. Do people need to like you? Like, what should you do to make people like you? What kind of compromises are you willing to make in your life to make people like you? What are you willing to give or not give? And then we get to the real discussion, which is, you know what? This is something I'm willing to compromise. It's important for me to be liked. It's important for my in-laws to like me. It's important for my boss to like me. But this is what I'm not willing to give up. This is what I'm not willing to give up. This is what I'm willing to compromise. This is what I'm not. And then I'm like, fantastic. Sounds great to me. If you feel you're shallow because you want people to like you, I'd say go for it. Go be shallow. If you have decided with a clear head and calm mind that these are your values and that being appreciated by others is important to you, I'd say go be the shallowest fucker on the planet. And draw a line in the sand about what you are not willing to compromise. Tends to work great. TBH. Anyway, the rant has ended. Great question, though. Just talk to your therapist about feeling judged. So all these are going to be the same. So Sunita at 30 saying, hey, Dr. K, how do you know if it's time to leave therapy, change therapist? I've been thinking that I need a change. I'd talk to your therapist about it, right? And then the question is, can y'all do the change? So like, here's another example. Okay, so like, I guess this is turning into common problems in therapy 101. So how do I know if I need to change my therapist? Really common problem, right? So this is where I'd say the answer is talk to your therapist about it. And then people are like, well, you always say that. That doesn't help me. So let me give you an example of why you should talk to your therapist. So when a patient comes in and says, I feel like I may need a change. So as a therapist, I've got 2 or 3 options, right? Number one, okay, let's like understand maybe our treatment has run its course. Maybe I have helped you as much as I can help you. Maybe I can help you a little bit more, but maybe you would actually benefit from working with someone else. In fact, I have a colleague who specializes in a different kind of therapy that I think you'd be a great fit for. That's actually one of the options. Number 2, okay, why do you feel like you need a change? Okay, maybe like you're actually done. Like maybe we've done the work that we need to do. Let's talk about what you want to work on, what your goals are. Maybe you can just go. We can be finished. Number 3, okay, even if you need a change, maybe it doesn't have to be with another therapist. What is not working about this relationship? What do you want to get more out of therapy? You can absolutely talk about that. Let's talk about how to make this time worthwhile. One of the things that I really detest about 25% of people in my profession is they never have conversations like that. This is kind of like meanders on. Well, what do you think you need? Let's talk about that. Here's what I think you need. Here's what you think you need. Let's figure out how to make this relationship worthwhile so you can problem solve that with your therapist. Number 4. This is where things get tricky. Maybe the reason that you feel like you need a change is exactly the thing that we need to work on. Do you abandon relationships because they get boring for you? Do you move on to other people before they can get to know you? Should you let your desire for change actually lead you to start changing your life and thus keep you from forming real connections? Is the desire to change what we need to work on and to learn to be content in a particular relationship and not run away now that I'm getting to know you and now that we're actually starting to get there? You feel like you need to change precisely because we're actually doing real work. And you're starting to realize that I am starting to understand who you are. And that thought terrifies you. So what your mind is actually doing is coming up with a defense mechanism, which is saying, this isn't working for me anymore, and now I need somebody else. That's an option. Which one of those applies to you? How the hell am I supposed to know? Which is exactly why you should talk to your therapist about it. And hopefully this is what's going on in your therapist's head. They're thinking through these different things. And I'm sure there's a dozen other things that therapists who are far better than I am will think of that I absolutely missed. But when we say talk to your therapist, that's what we mean. Great question. Okay, another question. Dr. K, is it ever a point of hurt pride or feelings of the clinician if a patient tells a therapist they think this isn't working out or wants to see another therapist? Absolutely. So does it hurt a therapist's feelings if a patient says, I want to see another therapist, or this doesn't work for me? So I'm going to tell you all the story. I was working on an inpatient psychiatry unit, and I had a patient who I'd done really great work with. And we'd done really good. So they came in, were like really, really suicidal, got to know them really there. They were there for about 10 days. I thought I did a fantastic job. They were feeling a lot better. And discharge planning came. So this is when someone leaves the hospital. We have to set them up with a therapist. And they decided that they wanted to stay at the institution they were hospitalized. And so I was talking to this person. I was like, okay, so like what, let's talk a little bit about discharge planning. And they're like, yeah. So this was a woman who was an ethnic minority who was also in the LGBTQIA community. And so they're like, yeah, I really want a therapist who, fits these criteria. So I want someone who's also an ethnic minority. I want a woman, and I want someone who's LGBTQIA. And I was like, totally understand it. And it hurt my feelings a lot. Because I was like, I thought we did really great work. I actually really wanted to continue working with you. I think, even though I'm cisgendered, heterosexual, model minority man, and you are on the opposite end of the spectrum, I really would have hoped that we would have continued working together. I really enjoyed working with the patient. I didn't say that, right? Because the patient gets to pick. But it's totally fine to hurt our feelings. Like, that's okay. I think as long as you're not unethical about it or malice, or don't have malice or anything like that, your job as a patient is not to protect the feelings of your therapist. In fact, it's the other way around. You can hurt our feelings. It's okay, right? So managing our feelings is part of our job. That's something that we get trained in. And sometimes we get hurt because someone else can do a better job than us. And just like any other human being on the planet, sometimes we don't like not being the best at something. And this is the other thing. It's okay, right? So what I've come to understand is that it's not my patient's responsibility to take care of my feelings. Now, if they're trying to be malicious, that's a completely different story. So if a patient is intending to hurt or manipulate me in some way, that's not acceptable. But for someone to say, hey, I don't think you're the best person on the planet, I want to go work with someone else, oh yeah, that's totally fine. Do I feel hurt? Sure. But that's where my feelings of being hurt is not what's important. What's important is what's the best for the patient. And whether I agree with that patient or don't agree with that patient, that should be what guides me. So if, for example, I have a patient who's like, yeah, I want to see someone else, and because I think they're shopping around for magic bullet syndrome, which is they're shopping for the perfect therapist who will be able to fix all their problems. And if I think that's their problem, then I'll push back a little bit. I'll be like, well, here's something that I'm concerned about. Right? That you think that some therapist out there is going to be able to fix you. It's my assessment that this is actually playing into your dynamic of shopping around until someone fixes you. And it's playing into the dynamic that someone else out there and the most brilliant therapist in the world will be able to fix you. Whereas really, I think you need to fix yourself, and I'd like to help you do that. And they may say, I disagree. I think you're just bad at it. And I'm like, all right, totally fine. Why don't you go try someone else? Good luck, right? Totally fair. Makes sense. Okay, so this is great. I wonder what it's like being on the receiving end of a manipulative patient. So some people may think, oh my God, you're a therapist. Isn't it terrible to work with manipulative patients? And this is where I say, oddly enough, not really. And you may be like, wait, hold on a second. How can that possibly be? Let me explain something to you. There are manipulative people all throughout your life. You're going to run into manipulative bosses. You're going to run into manipulative romantic partners. You're going to run into manipulative family members. The reason that it's sort of okay as a therapist is because you know what's going on. You have boundaries around the relationship and you're trained with it. So I'd say that dealing with a manipulative patient in some ways is better than normal life, because in normal life, those people exist anyway. And they're creating all kinds of trouble, but just no one knows, right? So it's sort of like, I can't even think of an analogy. It's sort of like, oh my God, you're a scuba diver. Isn't it terrifying to swim with sharks? And it's like, yeah, I mean, I can swim with sharks and I can have my cage and be safe. Or it's like I'm swimming in the ocean anyway and I got no cage. In some ways, as a therapist, you have a lot of training, you have a lot of protections, you have a lot of boundaries that you can kind of lean into. Is it easy? Not necessarily. But in some ways, it's actually way better than dealing with them in real life. Right? So good question. If he doesn't see it posted again, I didn't see the question from, okay. So actually, let me ask y'all real quick. And I think Tech Teller's hanging around in chat. So let's do a quick poll. Do y'all want to talk about like boredom and stuff? Therapists get frustrated because intellectualization is my major malfunction. Is therapy just wrong for me? Okay, so if a therapist is getting frustrated with you because you intellectualize, there are a lot of like, I don't know how to say this. There's a lot of fishiness in that, okay? So the first is that I don't think therapy is wrong for you if therapists get frustrated with your intellectualization. That just means a couple of different things. One is you need to find a therapist who's okay with intellectualization. That's an option. Number two is just because a therapist is frustrated with you, that's a completely independent variable from whether therapy is effective. Do y'all see that? It's subtle. But like, if someone comes to my house for dinner, and they're an annoying house guest because they keep farting, that has nothing to do with whether they enjoyed my meal or not, right? So my frustration with someone and whether the process is helpful are like completely independent variables. Issue number two. Issue number three. Should I find someone else because they are frustrated with my intellectualization? This is where, honestly, can't diagnose anything on the internet. But sometimes when I work with people who are highly intellectual, their assessment of my frustration is actually a projection of their own frustration. And I know we don't usually go for the psychoanalytic, like everything is a projection defense mechanism kind of thing, you know? But sometimes it's like, the question is, are you frustrated with your therapist because you intellectualize too much and you're not making progress? Right? So there's a lot that could be there. But in general, I'd say, maybe you do need to switch therapists, but I wouldn't give up on therapy just because you intellectualize. In fact, there are books written on intellectualization. Every therapist gets trained in how to deal with intellectualization. Some people are better at it than others. Some people connect more with different kinds of patients. Second thing is, just because your therapist is frustrated doesn't mean you're making progress. And third thing is that you got to be a little bit careful about how you're assessing whether your therapist is frustrated in the first place. And this is also where, like, sometimes as a therapist, I will tell my patients, hey, this is really frustrating for me. Doesn't mean that you need to change it. It just means that I'm just voicing my frustration to get it out there. And sometimes it works really well, actually. So this is where, as a therapist, one thing I've really found is that if I am frustrated with a therapy relationship, there is a very good chance that the patient is feeling frustrated too. Because when you sit with a person, the empathic circuits of your brain are both sort of feeling the same things, right? Like, I don't know if this kind of makes sense, but if you're talking to someone and they think you're creepy, chances are you feel awkward. Do y'all get that? The creepiness and the awkwardness go hand in hand. They're empathic. And in the same way, oftentimes, if I bring up the frustration and I say, hey, I'm frustrated by this, and then what does the patient do? Sometimes, depending on what their ego structure is like, they feel terrible and they feel like they're doing something wrong. In which case I say, no, I'm going to be frustrated with you and you're not going to fix it. You're just going to tolerate my frustration. You're not going to do anything differently. Wait, you want me to keep doing the things that frustrate you? Absolutely. Because progress for you is not caving into other people's feelings and being a doormat. So I want you to keep doing the crap that frustrates me. That's actually what you need to learn. That's one option. Other option in terms of frustration is that when I tell a patient, hey, I'm frustrated with you, what do you think happens? You're frustrated with me? Bro, come on, man. You're doing so much crap wrong. You're frustrated with me? I'm going to tell you why. I'm frustrated with you. I'm frustrated with you because of this, because of this, because of this. And then what do? I sit back, I say, thank you so much for telling me. Let's work on those. The first thing you said was this. Let's tackle that. Second thing you said was this. Let's tackle that. Third thing you said was this. Let's tackle that. And now we're working through all the frustration and we're actually doing a really great job. I would almost say that most of the patients that I've had really, really strong therapeutic relationships with, where I've helped them, we've had that conversation in some way, shape, or form. Because at some point, you're not going to be perfect. And there's going to be something frustrating. And so you're going to, you got to work through it. And that's what's really cool when someone's saying full Karen patient. So when a patient goes full Karen on you, and I want y'all to think about this. When a patient goes full Karen on you and you are there for them at the end. When a patient goes full Karen and you're like, wow, I never realized how frustrating this was for you. I'm really amazed that you've been able to keep coming back for the last 6 months, even though you've been feeling this way. You're really committed to this. And maybe I need to commit to it too. I'm going to try harder. Right? I think we can do this together. I'm not willing to give up on this. Are you with me? Are you, can we give this another shot? What would the Karens of the world be like if people responded to them like that? Instead of what we do now, which is we tape them, we put them on the internet, and then everyone laughs at them. What do you think that does to a Karen? When the whole internet is laughing at Karens, what does that do to a Karen? You think it makes them more Karenish or less Karenish? So when a patient goes full Karen on you, that's not necessarily a bad thing. Right? This is hilarious. Ronan Slade is saying, you're telling me I'm a nuisance? Based. That'll be $150. So this is a great question. I guess today what we're doing is we're just answering questions about therapy, okay? How do you deal with feeling like you know more than your therapist because you've read a lot of psychology and therapy? So that's kind of like saying, like, I'm just trying to think about how to phrase this. So reading a lot of psychology and therapy is absolutely useful. Don't get me wrong. But like book knowledge and real knowledge are two different things. So that's kind of like saying, like, how do you tell someone that you're really good at sex because you've watched a bunch of porn? Like, sure, you've watched a lot, right? Or maybe you've read the Kama Sutra, or maybe you've trained to become a sex therapist. So like you've got to really think a little bit about. So I do think that educating yourself about psychology or therapy is useful, but I think it's sort of like you can read as many cookbooks as you want. It's not going to make you a chef, right? Like, are you learning something? Absolutely. Is it valuable? Absolutely. If you want to teach someone how to cook, does having had them learn a bunch of stuff ahead of time, can that be helpful? And that's where things get a little bit tricky. Because a lot of times what I'll see with patients who do a lot of research is they'll actually come in with certain preconceived notions. And that they can read particular stuff, but it's really hard to learn the skill of something like differential diagnosis. So sometimes people will come in and they'll be like, I've done a bunch of research, and I know that this is my problem. And I'll listen to them with an open mind. And be like, all right, tell me why you think it's the problem. Just because because they know themselves really well, right? They know themselves better than I know them. So I should listen to them. And I've also got to understand or remember that just because they've done research doesn't mean that they're right. And in fact, the hardest thing about research is the process of differential diagnosis. So here's a good example, right? So there's all these memes that if you look on WebMD is going to tell you you've got some weird cancer. And that's because what a lot of people will do when they do research is they'll check the boxes of stuff that applies to them, but they don't think about the differential diagnosis. So if someone says, I'm bipolar, or let's say I'm depressed, and they're saying oh yeah, I check all these boxes, but it's do you smoke pot every day? Well, yeah, but there's nothing wrong with pot. There's studies that show that pot doesn't. Did you know that using marijuana in a medical setting reduces opioid consumption by 50%? It's actually true. We have an opioid epidemic in this country, and there's a decent chance that marijuana may be part of the solution. Did you know that? Yeah, okay, interesting. Now the question kind of becomes, but hold on a second. Did you know that it's very hard to make a clean mood disorder diagnosis if there's active substance use? I didn't know that. I didn't read so much about the differential. Because that's what patients usually do, right? Is they'll read and they'll check things. So I think it's good that you're learning. I'm all for, I'm not afraid of patients having knowledge. I think it's it's only, you only have to be afraid if you're not confident in yourself and, but I think patients knowing stuff is fantastic. That's why we're here teaching y'all this. In fact, I think the biggest problem with mental health nowadays is that patients don't know stuff. We don't even teach all the basics. What is a mood disorder? It's we're sitting there the mitochondria is the powerhouse of the cell. By the way, maybe instead of teaching you all that, we should teach you about the basics of addiction and coping mechanisms. Which one do you think is going to help you more in life? Right? So if you know a lot, that's totally fine. You can know more than your therapist. If therapy was about the amount of knowledge that you would have, then I guess you would be better than your therapist. But therapy is not about knowledge. I mean, knowledge helps for sure. But there's actually research. It's called common factors research. So this is really interesting if you guys don't know this. So we have all these different kinds of therapy, right? We got dialectical behavioral therapy. We have cognitive behavioral therapy. We have psychoanalysis. We have Jungian psychoanalysis. Ooh. Right? For all these different kinds of therapy. Which one's the best? So a bunch of researchers sat down and tested them all against each other. What they discovered is they're all about the same. And that gets really confusing. It's wait a minute. How can they all be the same? They're so different. In psychoanalysis, you're meeting 4 times a week. You're laying on a couch. There's a dude sitting behind you who never says anything. And in another one, there's a therapist who's very active, gives you homework, gives you charts. You fill in worksheets. How are these two things the same? And what they discovered is that there's common factors. That the actual therapeutic benefit doesn't come out of a particular methodology, but comes out of something about the relationship and the alliance and the trust and the listening and all that good stuff. And so then it's the knowledge isn't what's important. So interestingly enough, what is important, though, is the therapist should have confidence and have a comprehensive way to conceptualize a patient. So you still have to learn a theoretical framework, but you don't have to, it's not like this theoretical framework is better than that theoretical framework. It can be true sometimes, but generally speaking, it's not the case. I do think that some frameworks are better than others. Most therapists think that way, right? Because we use the ones that are better, and we use them because they're better. It's not that they're better and we achieve better outcomes because we believe in them more, right? It's that they're objectively better. So, I wouldn't worry about it. Like, if you think you know more than your therapist, you go and you tell them that. Hey, man or lady, I know more than you. I'm better at the therapy than you are. Oh, okay, cool. Tell me about that. What have you read? What do you think I should say? Yeah, wow, interesting. Because I have seen that. And it's not just, you don't have to just be intellectual. It's like I've had patients who have had like a dozen therapists, right? I've tried everything. Nothing works. Okay, so let's try to figure that out. Right? And you have to decide how challenging you want to be. So like sometimes like patients will come in and they'll say, no therapist has ever been able to help me. It's a challenge. And sometimes you got to be like compassionate, right? Where you can say like, oh, wow, that's bizarre and must be very frustrating. Because if you've done so much work and nothing seemed to help you, sounds very frustrating. Maybe they need compassion. Or maybe they need you to throw down with them. Right? So, oh, no one's worked. Wow. You must really suck at therapy. Because what's the common denominator, bitch? You don't say that. I've never said that. Right? So what I'll usually say is like, what are you doing here? If you want to be more challenging, right? If it's never worked for you, why are you here? Like, what's going on? Why keep doing something if it's not going to help you? Right? And that's what they'll say, well, I was thinking maybe like you're a little bit different. I've gotten that a lot, by the way. And I'll say, okay, so like, what are you looking for from me? Okay, I'm looking for this. I want to learn how to meditate. I want to learn about like Eastern philosophy. Cool. We can absolutely work on that. Is it going to fix you? I have no idea, because what you're telling me is that you've had a dozen therapists and a lot of them seem super competent. And so I don't know if I can help you, but I'm happy to give you what I can. It turns out things are great. They're doing better at the end. Right? Yeah. Yeah, so Polar Etude is saying, I have a healthy gamer coach since I want to try out the program in case I want to recommend it to folks. And he's already said, to say you're different from 99% of my clients would be an understatement, to say the least. Yeah. That's good. It sounds like your coach has really seen your individuality. Yeah, so Rhett Ad is saying, I just feel out of place in therapy. So look, if you feel out of place in therapy, the reason you feel out of place in therapy, because therapy is weird. It's normal to feel out of place in therapy. I just want you to think about this objectively for a second. Therapy is a place where you go, let's say, assume once a week. You sit in someone's office and you just talk about you. You never talk about them. It's not equal in any way, shape, or form. Most relationships are reciprocal. How was your day today, Mom? Good, honey. How was yours? Doesn't happen in therapy. It's weird. You see this one person, you tell them your deepest, darkest secrets. They hand you a tissue box. Maybe y'all hug. Does the same time work for you next week? Yeah, it works for me. Okay, bye. You walk out the door. You step outside. You pay your parking meter and you go on your life. And 15 minutes ago, you were talking about some terrible trauma in your life. It's weird. The reason you feel out of place in therapy is because therapy is weird. It's an out of place thing. That's exactly why it's valuable. Because in the rest of the world, there are all of the attachments. Right? If you were a man, and I've seen this, and ooh, it's brutal. If you were a man who is sexually abused, or if you were a man who is addicted to stuff, like substances, and you sold sexual favors to other men so that you could get drugs, and then 6 years later, you're sober and you're getting married and you have no idea how to explain that to your fiance, whom you love, and the way that they're going to look at you when you tell them. You can't ever tell that to people. You can't tell your parents that. You can't tell a single human being. except for your therapist? Why do you feel out of place? It's because therapy is out of place with the rest of your life. That's the whole value of it. It's a corner of your life that is completely segregated from everything else. And that's why you can go there and you can say whatever you want. And nothing that you say there has to touch any other part of your life. That's what the value is. So it's completely ordinary to feel out of place in therapy. It's because that's the way it's designed, is to be out of place from the rest of your life. And so of course you're going to feel out of place there. Doesn't mean that over time you can get used to it. And then you'll really start to see what the value is, because it's a place that's completely disconnected. That's the whole point. Great point. Okay, couple of good questions. One is, can you be your own therapist? So I'm going to say that the answer is yes and no. So I know it sounds kind of weird, but if you look at a lot of what the goals of therapy are, they are essentially to have the patient do for themselves what the therapist does for them. So for example, like, especially with like CBT and some of these other kind of techniques and stuff, we do want to teach people. So like we want to, like, let's say that someone has very bad negative self-talk, right? So they're beating themselves up in their head all the time. If they come to therapy for a while, a therapist will model positive self-talk. They'll model compassion. So how does someone who feels terrible about themselves learn to love themselves? Well, to begin with, we can start by compassion from a therapist. So when you come into my office and you feel like, oh my God, I'm the worst piece of crap on the planet, and then I demonstrate compassion to you at the very beginning, you're very confused. Why is this person showing me compassion? I don't deserve it. And then we keep doing that for a while, and then you're like, wait a minute. Maybe I do deserve it. Maybe I really am being harsh on myself. And then you start to internalize that positive self-talk, starts to fight against the negative self-talk. And then eventually, when you don't need the therapist anymore, you're able to say, hey, I made a mistake. It's okay. I made a mistake. Everyone makes mistakes. I still love myself. I'm still a good human being, and I can try again tomorrow. And by the way, I should really try not to make that mistake again. That's a great outcome. So in that sense, you've almost internalized the process of therapy, which can be one of the goals. There are also a lot of good cases of therapists working on themselves in some way. So like Jung and Freud are good examples where they did their own dream analysis and really looked into their psychology and applied some of these techniques to themselves. In the case of like the yogic traditions, and especially if you're looking at things like dialectical behavioral therapy, so that's absolutely where, the goal of, so DBT is where we've incorporated some kind of mindfulness into psychotherapy. And a lot of that stuff you can learn on your own or grow on your own. You don't need a therapist. And in fact, the way that it was originally designed was DIY. So the whole meditative tradition is supposed to, in a sense, be done kind of on your own with the guidance of a guru, but you still have to do the work. And independence is absolutely a goal. So I think you can sort of be your own therapist. The caveat is that a lot of people will avoid therapy because they want to be their own therapist, because they're afraid of having a therapist. And they're looking for someone to give them license to not go to therapy. Because if I say, oh, yeah, you can be your own therapist, you're like, great, I can just do it all by myself. Right? Oh, thank God. Dr. K said that I can be my own therapist. Because then I don't have to see anyone. I can just order all these books on Amazon. I can watch Dr. K videos, and then I can fix myself. I can do it all by my lonesome. Awesome. That's exactly the answer that I wanted. That was the answer that I needed so that I don't have to open up to someone. I don't have to rely on another human being. I can do it by myself, and then I can prove to myself that I'm a good person. I'm not pathetic because I need to go to therapy. Right? I'm going to be strong. I'm going to do it myself. In which case, I'd caution you a little bit. Right? If you're listening to that question and you're thinking, oh, thank God I can be my own therapist, I would pause for a second. Why? You should ask yourself the question, why do you need to be your own therapist? What's wrong with having someone else help you? Why do you need to do it by yourself in the first place? If you have an instinctive hunger to be your own therapist. And if you have this instinctive resistance to having someone else help you, that's something you need to really look into. Can you solve that problem on your own? And now we go into the inception. Can you fix that problem on your own? Maybe. Now we go even more weird meta paradox. Maybe the way that you solve that problem for yourself is that you sign up to see a therapist. Because the way that you need to fix the problem of self-reliance is to ask for help. Who knows? So one other thing that I'll say is that, therapy can be hard, and you're talking about negative emotions and all this kind of stuff. But in my experience, therapy can honestly be a lot of fun. And I know it's a weird word to use. We don't think about therapy as fun. I'm not recommending it as like recreation. But I'd say that there are a lot of moments that I find like very gratifying. And even with my patients, we'll like have a laugh together at how absurd this is. Right? And there's like something like really like positive about the whole experience. And it can actually be fun, even though you're talking about kind of bad things. And I don't understand that fully. It's something that I wonder about. But, there can be some really like warm, touching, positive, funny, like it's kind of hard to describe, but there are kind of these moments where someone will kind of be talking to me about how crappy their life is. And sometimes I'll be like, boy, how fucked are you? And then we'll kind of laugh about it, because that's kind of the truth of the matter, right? Is that sometimes like people are just really screwed in life. And then like the real beauty of it is that that's not where it ends. Like the problem is that when you're screwed in life, that's where the discussion ends. Right? So you think, oh yeah, I am screwed in life, so I might as well go kill myself, right? People have thoughts like that. But honestly, like the beauty of therapy is you say, yeah, you're screwed in life. And that's when your journey begins. Right? There's like something very subtlety, which I think therapy offers, which is beautiful, is now what are we going to do about it? That's not where things end. That's where things start. How are we? It's like walking into a house that has been wrecked by a hurricane and looking around this absolute mess, being like, man, this is a mess. Where are we going to get started? And then you start cleaning one thing at a time. And I know it sounds kind of bizarre, but even if you have a house, that's an absolute mess. Every step you take is one step in the right direction. It brings you one step closer to the goal. You can get the house back to pristine condition. You absolutely can. All houses can be repaired. And I believe all humans can be fixed. You just have to, don't stop with you're screwed. That's where you should start. And then do like one thing at a time. All right, let's figure out your relationships. Let's figure out how to set boundaries. Let's figure out how to deal with being a doormat at work. Let's figure out this piece and that piece and this piece and that piece. And if you work at it for a while, you'll be amazed. Because then what happens? Someone comes in and they're so depressed, right? Because their house is an absolute mess and they have so much work to do. And they've only done 20% of it. And this is where you got to be really careful. Because if you've only done 20%, you can do so much effort. You can walk into your house and you can say, my God, look at how much I have left to do. And on the flip side, something very interesting can happen. Is that you can do 20%. You can say, wow, even though I have a ton left to do, I actually did this 20%. I'm 20% of the way there. I didn't think I could ever make progress, right? Because if you're at the end of your rope, that's what you're thinking. You're thinking this is too big to handle. It's too big to handle, and it's too big to handle, and it's too big to handle. But you keep handling it, you keep handling it, keep handling it. Something beautiful happens. One day you walk in and it's not even 51%. Honestly, with most of my patients, it's not 51%. It's like 20%. They're like, wow, I can actually do this. Right? I've made real progress in my life. I deserve a pat on the back. I recognize that my house is a mess, but, if I keep at it, like it looks like this will end up pretty well. And then the other thing that's really crazy is that people assume that the first 20% is just as hard as the next 20% and the last 20%. So here's what I'll tell y'all. The first 10% and the last 10% are equally hard and the hardest. The middle 80 is actually pretty easy. You just think about it. Think about writing a paper. right? Getting started is the hardest part. You know what else is the hardest part? Actually finishing. Because when you're 80% done, you're like, I can take a break. I just have a little bit left. Now I can go game. I've done enough for today. So the first 10%, the last 10%, those are the hardest parts. It's the middle 80 that's actually really easy. And when you really think about it, what is the part that scares you the most? It's not getting started, and it's not finishing, because finishing is a win. And getting started, you can get started, but it's really the fact that there's so much to do that getting started is worthless. Right? Because when there's so much to do, what's the point of getting started when there's so much to do? And so what we're actually scared of is the 80%. When that paradoxically seems to be the easiest. Because once you're trucking along, once you're trucking, you make good progress. And you want to give up. I've written 80% of my paper, 90% of my paper. It's due in 4 days. I can finish it tomorrow. You ain't going to finish it tomorrow. You're going to finish it the night before. Right? So be a little bit careful. Even if you're kind of like thinking this is, there's no hope for me. Give it a shot. You'd be surprised. And good luck to you. Okay. That's kind of interesting. So I see that Easy Corn is saying, I always look forward to group coaching. It was super fun because I have conversations with people I actually found interesting and engaging, and I learned to open up. Yeah. So I think this is where it's kind of interesting, but what we're discovering from a lot of recent research is that there are all kinds of factors that we didn't really appreciate or target in terms of improving mental health. So these are not like diagnostic things. So I'll give you a good example. So meaninglessness and loneliness. There's a recent study that showed that meaninglessness is the variable that correlates the most with pornography addiction. So who gets addicted to pornography? It's people who feel like they have no purpose in life and are meaningless and are drifting. Because when you're drifting in life, you might as well watch some porn. There's no cost to watching the porn, right? When there's whereas if there's some price to be paid, it's people will not be quite as addicted, generally speaking. The flip side is also loneliness. So there's some evidence that shows that, there's some things that are risk factors for suicide, actually. So male gender, or owning firearms, there are these kind of factors, right? But then the other thing that we sort of started to realize is that loneliness is a huge risk factor for all kinds of different stuff. And so one of the things that we've really found, and we're kind of confused by this, because when we'll do group coaching, it's not group therapy. It's not designed to be group therapy. And yet people start to feel more socially connected. They start to improve different parts of their life. If y'all have seen the group coaching stream, I think the proof is in the pudding. If y'all can check out our stream from yesterday, and you'll hear from them what group coaching does for people. And it's kind of weird, right? Because we come in thinking, okay, I want to solve this problem. But oftentimes what gets us to solve the problems is not what we think is going to work. But it's just sort of connecting with people and not feeling lonely. And once you start not feeling lonely, you start opening up a little bit. Once you open up a little bit and people accept you for who you are, now you don't have to hide who you are. If you don't have to hide who you are, you can show up at an interview and not be paralyzed by anxiety. Because you're thinking, oh my God, what if they see the real me? Imagine what your life would be like if you didn't go through it thinking, oh my God, what if they see the real me? And how do you get comfortable with people seeing the real you? Right? Think about it. Because the whole problem of people seeing the real you is that you can't afford to show them. Because what if they don't like it? The consequence of showing, the risk of showing the real you is too high. So what do we do about it? You practice showing the real you to a group of people who do not touch your life at all. This is the challenge of opening up. Because if you open up to someone, what if they reject you? This is why, and people hate it in group. Early on, we had a straight up revolt in group where people are like, we want to play games together. You can't control what we can do. And you're right, we can't control it. Why the hell do we encourage people to hold the boundaries of group while group is being run? It's because the moment that y'all create a relationship outside of it, it becomes the rest of the world. The moment it becomes the rest of the world, all of the concerns and fears come flooding into group, and then you can't do the work of group anymore. So go there and practice being you. See what people have to say. You know, and it'll happen like one toe at a time. You're going to put a toe in the water and then a foot and then an ankle, and one of y'all will lead. I don't know if y'all realize this. If you've been in group, you'll know what I'm talking about, hopefully. But one person puts themselves out there, right? And then what that person does is demonstrate, hey, it's like okay for me to share this thing that's like kind of scary about myself. And then the other cool thing about group is they're going to hold you accountable. Right? The other cool thing about group is that when you win their respect, it's kind of like if your therapist says, "Oh no, like you're a wonderful person." Like there's a part of your mind that's like, they're getting paid to say that. Is my therapist ever really going to tell me I'm a terrible human being? But when it's your peers and they say, "Actually, you're a good human being. Actually, you kind of screwed up there." I'd like to challenge that perspective. Means so much more. So this is what's so tricky, right? Is how do you find a group of peers that will help you work on your problems? And this is what's so interesting is in group, we actually don't encourage non-judgmentalness. So people will say like, I thought this was a safe space, and it's sort of safe, right? So we expect confidentiality and no malice and things like that. But we don't actually, one of our core values is not non-judgmentalness, even for our coaches. We don't ask our coaches to be non-judgmental. We ask our coaches to be authentic and compassionate and present. Same for all our clients in group. So we want you to, if you have a judgment, share it with people. If someone's screwing up their life, like in group, like tell them, hey friend, I think you're really making a mistake here. And say it with compassion though. Say it out of a desire to help. Say it to support them. Point out to them what mistakes they're making. Right? It's really a fine balance. Yeah, so Easy Corn is saying it hits so hard to be liked in group and people being sad for me leaving. I felt important to someone else's life, if even a little bit. And so here's the beautiful thing about that in group. So sometimes in real life, people are sad to see you leave. But the tricky thing is in real life, there can be a reason they're sad. Right? Oh, I'm sorry you have to go. Now I have to do the dishes myself. I'm sorry you're leaving. Now I have to deal with this boss all by myself, and I won't have you to share the load. I'm sorry you're leaving party queue. Now we're going to start losing because you've been carrying our crappy asses. But in group, what are they losing? The only thing they're losing is you. They're not losing money. They're not losing MMR. They're not losing time or energy or food or access to this or discounts to that. All they're losing is you in your purest form when you offer them nothing except for yourself. And that's when you begin to realize, oh crap, I have value. I didn't realize that. I didn't realize I have value outside of what I bring to people. As a human being, I have inherent value. And this is the challenge that we face is that, so people will ask a question, Dr. K, how do I discover my inherent value? And the real challenge is that like everyone wants to know how to DIY it, right? Like tell me like what sequence of steps, A, B, C, D, E, F, G. How do I discover my value? Lay it out for me so that I can do it. You know, and this is just one of those things where it's like, honestly, the best way to do it is to join group. Best way to do it is to like actually get involved. Like we'll do what we can by lecturing, answering questions. Like honestly, we're going to do that. We're going to do it as best as we can. But there's just no substitute for you like leaving a group and people being like, we're sad to see you go. I can't give that to you. There's no amount of answering questions. Like, you know, at least I haven't been able to find it yet. We can help you understand things. But I don't know that, and y'all will see this, right? So like when we do interviews and stuff like that, and like when we'll have like call-in streams and things like that, where like people appreciate other human beings. It's like, that's the only way. It's got to come from another human being. And then the challenge that people face is that if you tell someone, hey, like your value has to come from another human being, then they're like, well, that's not going to work for me because I'm socially isolated. I don't have any friends. I live alone. I do this. I'm in a toxic home environment. And so it can feel so powerless in life to like require another human being for your growth, because now the responsibility of finding that human being is on you. It's tough, right? If someone else has to teach me, if someone else's love is what leads to me loving myself, then that means that my self-love is not in my control. It means it's in someone else's control. And we don't like that thought. It terrifies us. I'm not in control of my life. Yeah, that's the truth. Hate to break it to you. Think about it for a second. What do you actually control about your life? Can't make someone love you. Technically, you can't even make someone hate you. It seems to be easier to accomplish. And I know that all y'all chat trolls out there are going to be like, challenge accepted. I mean, practically you can't, but, you know, because you can't control someone else's reactions. You can only control your actions. And there are some things that, I hate to say it, but human beings are not solo creatures. We're communal creatures. We're tribal. Like our brain is designed, like, I don't know, like, you know, if a human being doesn't experience dialogue and speech for the first couple of years, they will never learn how to talk. The human brain is designed for community. And so now we have a society that is disconnected. There's a phrase, diseases of disconnection. This is why we're losing the war on mental illness. We're disconnected. What's the antidote to disconnect? To connect. This is where all y'all say, but I don't know how to do that. Give me a guide to connecting to other human beings. Right? Which is, sure, we're going to try that. But this is where, like, sometimes you got to just do it, right? And you say, oh my God, just do it. And it's like, that's why, like, we've tried to make it as simple and safe and easy as possible with something like group coaching. We've tried to smooth it all out. You sign up, you show up. You're not expected to know anything. You don't have to bring any value to the table. And then the confusing thing is then people are like, this goes back to the whole medication thing where it's like, well, what am I going to get? How do I know it's working? And that's what's so hard. We're working on that. Hopefully we'll get better at it in terms of like helping y'all facilitate things and stuff. But it's hard. It's hard to describe. So even if y'all are curious about this, y'all should watch. We just did our last creator group stream. Y'all watch that last creator group stream. I think we have a YouTube upload from our first creator group stream. And I want y'all to watch stream 1 and then watch the last one. And you will be, no one knew on week 1 where they were going to end up at the end. No one had a clue. Like no one had any idea. Everyone learned a ton about themselves and like improved their life and stuff like that. But it was not in the direction that they wanted. It was in the direction that they needed. And the biggest challenge that we face is that oftentimes what you want is not what you need. That's so huge. Right? So it's like, that's what's so tricky. They're like, okay, I want this, because you think you know what your problems are, and you're not wrong. But it's also like there may be like a diagnostic blind spot. And what I think I'm really happy about in terms of group is that it tends to address, or even coaching in general, is that it addresses our blind spots. That's really what it's designed for. And so when we use this Vedic model of the mind, which is in Dr. K's guide, and we've done like YouTube lectures on it and stuff, y'all can go check out our mental health boot camp from like 2020 if y'all are, interested in like YouTube stuff. It's all free. And go watch some of that stuff about the Vedic model of the mind. Because we don't realize what our cognitive biases are. We don't realize what our ego is. We don't realize how it shapes our actions, how it shapes our thoughts. And so the biggest challenge that we face is because we don't really know what you need. All we know is a methodology of discovery. That's really what group is. It's a methodology of discovery. And now that's really tricky because you don't know what you need, but what we have is a methodology of discovery. And now you can actually watch it, right? So like what we saw is, it's kind of weird. Right? It's like people discovered things about themselves. And like people like flip-flopped. If you make a transcript from week 1 and you make a transcript from our final week, and you pick a statement and you ask who in the group made the statement. It'd be a fascinating experiment. I'm kind of spoiling it already. But what I'd love to do is like get impressions from week 1. Who makes what kinds of statements? And then get impressions from the finale, and you'll be stunned at how much people have like grown from each other. Some people who are like self-deprecating and memeing and stuff are saying these like really powerful, authentic, compassionate things. And people who are like very, very positive and compassionate and warm and supportive on week 1 are like talking about like ambition and business plans. And it's like, wait, what? Yeah. It's wild. The challenge is just, if you ask me like, what am I going to get? I don't know. That's the whole problem. Is that we don't know what you're going to get. Like we have outcomes that we're confident in. If there was no like general improvement, right? And the outcomes are strong. But in terms of like, what are you going to get? Like even I couldn't predict what people were going to get from group on week 1. I can't. All we have is the methodology of discovery. Anyway, shall we meditate and then get to ask a coach? Okay. So let's do where can I read more? I don't know where you can read more. I mean, I'm sure we've got a website or whatever that like generally describes it, but I would say you should honestly, like watch that first YouTube video. It's going to be quote unquote boring. It's not like, that's the challenge, right? It's not like fun to watch, but I would really watch it if you want to understand how change happens. And this is the real challenge with change, right? Is we make change looking sexy, but that's not actually how it happens. Like all of our media and stuff, will even like transform into Super Saiyan. You'll see all this like fire and lightning and music, and like someone's like one way and now they're like ripped over here, and it's like 6 seconds and very flashy. That's not how real change happens. Real change happens slowly. Real change is not entertaining to watch, and real change usually happens without you realizing it. Right? And so I'd say watch the first week on YouTube and then watch our finale. And then you'll see what change looks like. Okay. Volcanu, yes, meditation. Thanks for taking time today to answer questions from our community. Absolutely, right? So I think, we can, so let's do meditation. Okay. So the meditation that I want to teach you all today is going to be a little bit different. It's actually a meditation that I kind of stumbled upon working with a patient who was suicidal at the time. So I would just like to share with y'all kind of where this meditation came from. So I had a patient in my office about 3 years ago, a little over 3 years ago, who came into my office one week and was like, yeah, the suicidality is bad today. So we kind of talked a little bit about risk assessments and stuff like that. And I started to talk to them a little bit about, okay, what is the nature of you wanting to end your life? Because they had so many like worries and cares and concerns, and things weren't going well. And so what we really tried to do, and then we kind of like stepped out of my office and we like went for a walk. And we tried to understand what is like the most fundamental experience of life. And is that thing something you want to engage in and not, or something that you don't want to engage in? Because this person was kind of talking to me about how they don't want to engage in life anymore. And so if y'all are struggling with something like suicidality, I would absolutely recommend you see a mental health professional. And at the same time, I think that there's a lot that can be learned. And we also know that meditation and mindfulness can be an evidence-based treatment for things like mood disorders. So what I'd love to share with y'all is just the meditation that we kind of stumbled upon that day 3 years ago. So we went outside and we kind of, so we're going to start kind of the way that we do. And we're going to sit up straight. We're going to close our eyes. We're going to adopt a meditative posture. So relax the shoulders, back straight, neck straight. And what I want y'all to do is start to notice what your mind is concerned about. So in a weird way, we're going to start kind of on the outside. And I want you to think, we're going to start with thinking about all the stuff that the world wants from you or needs from you. Deadlines, work stuff, school stuff. Maybe you have to buy presents for the Christmas holiday or someone's birthday. You got bills to pay. You got to get your oil changed. You got to take out the trash. There's so many things out there that the world needs from us. And so notice that each of those things crosses the border into your being. That you feel stress. But where is the experience of stress? It's in your mind or your body. You may feel a tension at your temples, a queasiness in your stomach, a tightness in your throat, and warnings from your mind, thoughts berating you, bludgeoning you. And sometimes those thoughts can feel overwhelming. Sometimes they're emotions. And now notice how those circumstances on the outside get translated into opinions of yourself. And try to find that connection. Think about all of the things that the outside world demands of you, or that you quote unquote need to do, and how you form conclusions about yourself. It may be taking out the trash, or taking out the recycling. And as those tasks pile up, you start to form conclusions. I'm lazy, I'm undisciplined, frustration with yourself. But take a moment to notice that there's a task on the outside. That the trash can does not think anything of you. It's just a trash can. And all that stuff on the outside combines in your mind. And how does your mind make sense of it? It forms a conclusion. You are ... And this is a truth that you live with. You believe it to be true. I am ... I'm lazy. I am too old. I missed the boat. I'm a failure. Just notice those conclusions. And now start to peel away all of those layers. Let go of the thoughts with a deep breath in and out. Bring your focus inward. You can pick any alambana or support for this process. So you can feel your body, feel the weight of your body, feel the edges of your skin, your inner being. You can focus on the breath. Or you can listen to sound. There are all kinds of focuses, foci. If you are listening to sound, notice how the sound originates from the outside and crosses the barrier into the self. How the breath originates from the outside and crosses the barrier into the self. How the breeze originates from the outside and crosses into the barrier of self. And this meditation is done beautifully in a place where there is a breeze, something to appreciate about the outside world. The sound of water, sunlight, chirping of birds. And now notice how this, in this moment, this is what life is. Take a deep breath. This is what it means to be alive. This is what life has to offer. Very simply, when we peel away all of the layers, this is the one layer we can't peel away. All things, all thoughts, all sounds, all beliefs, everything crosses the border into ourselves. And you in your most simple state exist. Notice the neutral pleasantness. You may even notice that there's a distraction from the pleasantness. That at times your mind will focus on maybe your leg falling asleep, maybe an itch. And that as something pulls you away from that quietness and peace within, there's a disruption. And as you feel the itch, you can scratch it if you want to, or you can breathe, or you can focus on sound, whatever so you choose. Notice that at the base, at the very bottom, is peace. And now we'll come back can open your eyes. All the cares of the world are so important. And certainly they are. I'm not saying they're not important. They're very important. But they're not what life is. They're all the layers on top. They're the conclusions, the inferences, the extrapolations. At its core, life is, I'm not even going to call it beautiful. That's a judgment. Life just is. When you peel everything else away, what's at the core of existence? So I'll share with you all what I shared with that patient that day. When you peel everything back, what is it you're trying to get away from? What the person realized is the core of life is not what they were trying to get away from. What they were trying to get away from is all the extrapolations. In fact, the reason that they were suicidal is not because they hated life, but they had completely lost touch with it. That at its core, we were sitting on a park bench. I remember we got some iced coffee. And that life is, at its core, is actually great. It's when we get separated from it. When we get caught up in all this other stuff. And that's what happens. Now, did this cure their suicidality overnight? No, it certainly helped. They still needed treatment for some time. They're doing way better now. I'm thinking about them recently because they sent me a nice Christmas message. They're doing way better. Been good for a couple of years now. But it's not about suicidality or not suicidality. It's about, think about what you dislike about life and where is that dislike? You may say it's in the outside, or you may say it's on the inside. But really think about that. I dislike myself. That's on the inside. Well, hold on a second. Where did you learn to dislike yourself? What is it that you dislike about yourself? Well, I failed. Well, hold on a second. Where is that failure? Where is the transcript? Is there an F in here? No. The F is out there. Where did you get fired? Where did you get dumped? Well, I keep getting dumped. That means I must be the problem. No. It's such a logical step. But the problem is that it's not actually based on experience. It's the inferences of the mind. And the big irony is that the reason that we continue to fail and struggle in life is because we are disconnected from this. The reason that you keep on getting dumped is because you're trying to pretend to be something that you're not. And as you continue to be inauthentic, you set expectations for people. You pretend to love what they love to get them to like you instead of being who you are. And you can only keep up the charade for so long. Spend a little bit of time with yourself, just the simplest version of yourself. Nothing that has quality or form or success or failure. Do this practice. Go find a pleasant place to experience what it is to be alive. And watch out. You know you need to do this practice. If when I say go find a pleasant place, your mind comes back and says, what about the unpleasant places? Those will come next. When I'm teaching a child to swim, I say, let's go in the kiddie pool. The child comes back and says, but what about the English Channel? What about the ocean? That'll come in time. The problem is that with a kid, you can get them to go into the kiddie pool. The problem with adults, with you all, is that unless you can guarantee me the English Channel, I'm never going to get in the kiddie pool. I need you to fix that way over there instead of start where I need to start. You want to jump straight to the end instead of focusing on the beginning. So start with a pleasant place and sit and just try to understand what is the most basic element of life. All right, let's pop on over to so we have an interesting comment. So Nick's Embers is saying, this is one of the most helpful meditations I've had. Well, I'm happy that it was helpful to you. And I would even argue that this is not even a meditation. Of all of the meditations we've taught, actually probably not true, but this is one of the least meditations. It looks like a meditation. It sounds like a meditation. We pretend it's a meditation, but this is not meditation. The reason it's helpful is because it's a simple experience of existence. And that's what all meditation is. It's to bring us back to the most basic self. It's because why do we need this practice? Because we've gotten separated from ourselves. I was watching a squirrel the other day. The squirrel was just straight chilling. Hopped around a little bit, dug a little bit over here, hopped around, dug a little bit over there, hopped around, dug a little bit over there, just straight chilling. And what are we doing in life? Anything but straight chilling. Right? And for those of you who kind of say, but what about those of us who sit around all day and just straight chill and never do our responsibilities? That's not really chilling. What that is giving into certain impulses and desires within us. When you look at someone who's quote unquote straight chilling, they're oftentimes not chilling. What they're actually doing is avoiding. That's not straight chilling. It's not being one with themselves. It's trying to forget all the outside world. You may say, but isn't that what we just did? No, what we did is not forget. We just stepped away and started with a foundation. And this is the really cool thing. The more you get grounded in the foundation, the more you take that experience and you carry it around with you wherever you go. Because you can carry it with you into anxiety-provoking job interviews, into contentious interactions, into setting boundaries with other people, into a test. You can carry the peace with you. And then suddenly all of those things that you avoided can become easy. And why do they become easy? Why do you avoid them? Because you get uncentered from yourself when you're doing it. Think about this for a second, okay? Why is a test terrifying? When is a test terrifying? A test is terrifying when you're thinking about the failure. A test is not terrifying when you are trying to answer the question. In fact, the more that you try to answer the questions, the easier the test becomes. Then you're focusing on the test. If you're prepped for it, you may be SOL. But once again, if you haven't prepped for it and you don't know, what is the disruption in your being there? The disruption is the consequence. It's not actually the test. It's the world outside. Y'all get that? So Crunchy D is saying test is terrifying because of time pressure. I'm with you. Where is time? And this is the big paradox. The more you panic about time pressure, the worse it becomes. Oh my God, I'm running out of time. Oh my God, I'm running out of time. Oh my God, I'm running out of time. What does your mind tell you when you're running out of time? I need to focus. I need to focus. I need to focus. I need to focus. What are you doing in that moment? You're not focusing because you're thinking about focusing. Right? It's kind of like when you tell yourself, I need to go to sleep. Oh my God, I need to go to sleep. I need to sleep. Oh, I'm going to be tired tomorrow. I need to sleep. I'm going to be tired tomorrow. You're not sleeping. You're not actually with yourself. You're in your mind. Your mind is pulling you away from that. So just practice with the foundation of the simplest aspect of existence. This is what's real. And why do it in a simple place? I mean, a pleasant place. Do it in a pleasant place because that's going to be easier to learn. And then once you do it in a pleasant place, you can start to appreciate things that are unpleasant. And you may say, what craziness is that, Dr. K? How can I appreciate things that are unpleasant? Well, some of y'all may have heard about this rare thing called wine. And wine is something that tastes disgusting. And most human beings, when they first try wine, consider it disgusting. Unless they've got a certain genetic predisposition, in which case their first sip is delicious. But most human beings dislike wine when they start out. And then because it's bitter, it's sour. And then we learn to appreciate it. It's an acquired taste, they say. What the hell does that mean, an acquired taste? Think for a second. That means the appreciation can be acquired. It's not in the outside. It's on the inside. Right? It's not out there. So we can start to acquire tastes for all kinds of things. You may say, what madness is this? What do you mean you can acquire tastes for all kinds of things? You can acquire tastes for studying. You can acquire tastes for helping people. You can acquire tastes for exercise. You can acquire tastes for eating healthy and drinking water. And you may say to yourself, what madness is this? How can I ever acquire a taste for drinking water? This is where I'd say, go and exercise. And then see what you crave. Right? To water chat. Okay, let's pop on over to Ask a Coach. I see that we're running a little bit so let's you should be sponsored. Yeah. The question is, who are we going to get sponsored by? Okay. So let's pop on over to Ask a Coach. Hopefully we will be greeted by Tech Teller Pog. It should start in just a couple minutes. So I'm going to hop in. Okay, there's people waiting. So I'm going to sit in the waiting room. And y'all should join us. So this is good because most of the time we miss Ask a Coach because we're like late. And for once, they accommodated for Dr. K's tardiness. And all right, so we got to do something at some point. We got to go try to find the weirdest sponsor possible. Because some people, we've gotten some interesting sponsorship requests, and we tend to turn most of them down. But yeah, we're gonna be early. Actually, we were like 15 minutes late, which is 15 minutes early. But we're gonna go Manscaped. No, man, we get okay. Underwear sponsorship, yeah. Thong sponsorship, chat. Stretch goal. All right, so why don't y'all pop on over to our Discord? We're just waiting for the event to start. So for once, we'll be on time. So it gives you all a chance. Everyone go grab some water, use the restroom, wash your hands, and then hop into the Discord for Ask a Coach on Progress. So take care, everybody. We'll see y'all on Friday.